Thanks everyone for coming to support your workforce, why it's good business to add health coaching to your employee benefits package. My name is Danielle Heuseveldt. I'm the Central Region Medical Director for Crossover Health. I will be your host, but the star of the show today is Danielle Heuseveldt. She is our health coaching program manager. Definitely a thought leader in the company for our care model. She's both a registered dietitian and certified health and wellness coach. She obtained her bachelor's degree in nutrition from Marywood University and has been working in employee health and wellness for 15 years. She is an absolute expert. And before we get started here, just a little bit about Crossover, so you guys, kind of know who you're hearing from and our big picture of where we're coming from. So Crossover Health, we are a national medical group. We are licensed in all 50 states and provide a hybrid approach to care, meaning we meet patients in person in health centers, as well as online through video or asynchronous care. We have a core team, which you can see in the middle there in pink, including primary care, physical medicine, mental health, nutrition, coaching, and fitness services. All of this together creates a care team that we surround the patient with, using data to ensure that we're getting the right insights for population health. And we try and really solve problems with the patient at the center of our care, and all of those different service lines kind of working together to hit the quadruple aim. On top of those 4 service lines, again, that we can deliver virtually or in person, we monitor the health of the population. So we look at social determinants of health, chronic disease management, making sure people have all their screeners and closing care gaps, and that information's fed up to the care team to take action on. We have care management where we have special services and programs around key chronic disease measures and allow that care team to really work as a medical home and work in a very broad scope of practice. And then of course, there's a ton of digital health tools, some that we have internally and some that we partner with, because sometimes digital health tools in combination with in-person care can be the most effective. And then finally, just to kind of connect this whole system, obviously we try and treat and work with each member and solve their problem within our 4 walls or within our toolbox. But of course, we need to integrate with the outside world. So our care navigators sit on the same team with all of our health coaches and primary care team, et cetera, and steer, guide, and navigate each member into the secondary care network. So making sure that we're addressing reasonable cost and high quality outside our 4 walls, making sure people have access to their benefit ecosystem, whether it's the payer ecosystem or the employer ecosystem, or just community resources, so that we can really take a holistic approach, apply the biopsychosocial approach to different social determinants, and really be this different type of care model. So with that, we're talking about health, we're talking about our care model, and specifically health coaching. Danielle, thanks for joining us here. So what does that mean? What is health? What affects health? Can you kind of define this for us a little bit to kick us off?
Absolutely. I'm so happy to be with all of you today and talk about my great passion in life, which is health coaching. But really, before we talk about health coaching and how it can benefit your employees, we really need to talk about what actually affects health. Because I think there's a lot of misconceptions about what levers you can pull in terms of what affects health and the extent to which those levers will actually make a difference. And Dan mentioned this, the biopsychosocial model as our care foundation, and that is very, very true. So if we take a look at what affects health, we're looking at 20% being access. So does the person have access to care, and what is the quality of that care? If we think about 30% being attributed to health behaviors, so these are the things like tobacco use, diet and exercise, alcohol use, sexual activity, 30% of health can be attributed to health behaviors. 10% is physical environment, and 40% is socioeconomic factors like education, job status, family social support, income, community safety. So if you think about 50% of health being traced back to an individual zip code. And as we go through this presentation, we're going to talk about health coaching specifically, and how it is included in an interdisciplinary care model. But this is where really coaching can be key, because we can help folks with many of these. Certainly that 30% of health behaviors, coaching can address for sure. But even with some of the socioeconomic factors, the goal of coaching, as you'll learn through this presentation, is really to help meet somebody where they're at and help them make health-related changes based on that person's life. So what barriers are they encountering, right? Especially as it pertains to some of those socioeconomic factors. And then, as Dan pointed out, and as I'll show you in future slides in this presentation, when you're working as part of an interdisciplinary team, not one discipline can manage all of this, but coaching can sometimes play quarterback to help that person get to the things that they need to help overcome their barriers. So keep that in mind as we go through the rest of this presentation.
Thanks, Danielle. And I love how you mentioned each one of these disciplines, the physical medicine, physical therapist team, or the primary care team, or the mental, they can't take care of all of that as one discipline. Right. So integrating care is so important. None of this stuff happens in vacuums. Mental health doesn't happen on its own. It's part of the entire body and presentation. So that's right. It leads me to my next question. So then how does health coaching make all this work, and what's the health coaching role?
Right. So let's talk a little bit about what is health coaching. For those of you who might not be aware, health coaching is an expert facilitator of sustainable mindset and behavior change that generates sustainable, healthy lifestyles. It may prevent or treat disease. It can foster well-being and thriving. And so this comes from Well Coaches. Well Coaches is a very well-known health coaching school and approach / model. It happens to be the one that Crossover engages in. And the other piece that I want to point out with health coaching is, this definition aside, actually, can you go back to the other slide? This definition aside, we are what I like to call the change makers. We are the folks that are going to help somebody make the changes that are necessary and important to that person in order to move them forward in their health. And I think it's really important to point out, for all of you who may be thinking about engaging health coach services for your employees, or even maybe engaging in health coaching for yourself, coaching as a discipline is still a little bit like the Wild West. There's a lot of coaching definitions. There's a lot of coaching certifications, programs. Is a little bit all over the place. And Crossover, we decided to put the investment in moving all of our coaches towards board certification through the National Board of Health and Wellness Coaching, because they really did the work to figure out what are the fundamental and foundational evidence-based practices used in coaching. What are the techniques? What does it take to be an evidence-based coach? And so they approved training programs that they feel lead a health professional towards evidence-based coaching. So at Crossover, we use one of those training programs, Well Coaches, but we're moving all of our coaches towards board certification, because they have really set the standard in, again, what is evidence-based coaching? The field is a little bit all over the place, and what the National Board of Health and Wellness Coaches are doing, they're working to standardize what the evidence says and to build a credential around that. So I think that's important to point out, especially if you're looking around for health coaches or health coaching programs, that board certification really does mean something because, again, foundational evidence-based techniques. So on the next slide, this is demonstrating how health coaching can help support the primary health approach. So the World Health Organization notes the primary health approach as addressing the majority of a person's health needs throughout their lifetime. It includes physical, mental, social well-being, right? Biopsychosocial. It's people-centered rather than disease-centered. And the approach of primary health is meeting people's health needs, again, throughout their entire lifespan. It's meant to address the broader determinants of health through multi-sectorial policy and action, and empowering individuals and families and communities to take charge of their own health. That's the basis of primary health. So how does coaching support this? Well, as we look at the research, there are themes in coaching and, again, approaches that help support this model. The first theme is accessibility. And accessibility can be looked at in a couple ways. Coaches meet members where they are, quite literally. The beauty of coaching is that it can be done in person, it can be done over the phone, it can be done via video, it can be done synchronously, it can be done asynchronously. So we really do have the ability to meet our members where they're at. So if you think about that accessibility, also coaching tends to, our time is spent strictly on helping that person move forward. So we're talking even about the time we're able to spend with somebody on issues of changing their behaviors, figuring out what it is they want, working on strategies, experimenting. Coaching is more accessible than, say, working with a physician on those issues, because the physician has things they need to do with the patient. They have only so much time. Coaching tends to have more time spent on this one thing, which is helping that person make their behavior changes. So access, right? That's important. That's a theme. It's also a trusted relationship. And it's not to say that patients or members do not trust their physicians. Of course they do. And at Crossover, we really pride ourselves on the trusting relationships that we set up with our members. But oftentimes the role that coaching takes when we're using those good coaching techniques like motivational interviewing, really putting the patient at the center of the conversation, that trust and rapport is often built faster. And many times we may get information from the member that they don't tell their physician. Sometimes it's just based on the sort of societal structure that's set up between physician and just habitually in society, that the doctor knows best, I'm the patient. And our physicians really don't take that approach at all, and really work to set up a partnership, certainly with their patients. But because coaches have more time and our whole job is literally to meet the person where they're at, figure out what's going on with them, strike rapport, we tend to build trusted relationships faster, and we may get additional information from that person that they don't necessarily share with other providers. So we have that trusted relationship. Coaches can also provide education. Especially at Crossover, we hire coaches who are also health experts. So dietitians, we have a couple of RNs, exercise physiologists, who when necessary and with permission can provide education. And again, this is something that sometimes the physician-patient relationship or doesn't necessarily allow, because again, the physician's got a big job to do. The primary care provider has a big job to do in terms of helping this person sort of manage all of the things that are going on. And education can be part of that. But that is, again, one of the main things coaching can bring to the table. We can point members towards resources. We ourselves, if we're health experts, can educate when necessary and with permission. And we also, again, have layered on top of that the health coach knowledge so that we know and can offer up that education in a way that actually leads to change. I'm sure many of you on this call at one point in your life have been told what to do. And even though you knew maybe it was like the right thing, yeah, I get that this is the thing that I'm supposed to do. Anytime somebody tells you what to do, what's our natural human instinct? Our natural human instinct is to be like, no, I don't want to do that. I don't like to be told what to do. No human does. So what do coaches do? Because we have that knowledge, if we are offering education, we're offering it in a way and couching it in a way that, again, still puts the member in the driver's seat. We might say, hey, what do you already know about this topic? Oh, okay, great. Would it be okay if I shared some information about this with you? And then we may offer some education and even maybe some strategies. And then we'll say, and tell me a little bit about what you took from this conversation. What are some things you might want to start applying? And again, we're doing that because we're able to see what stage of change this person is at, where they are with their health confidence, and we're able to help guide them in a direction that's going to reduce resistance and move them towards the changes they want to make. We also provide personal holistic support. And I would say, especially again with crossover, our primary care providers are also doing this or looking at the person as a whole person. Coaching, again, we're able to do this within the context of those behavior changes. So how are you sleeping? How are you moving? How are you eating? How are you sleeping? What barriers are you confronting? What do those social determinants look like? We're looking at that person as a whole person, right? And so as we are guiding this person through these coaching conversations, we're able to take all of that into account, including things like, well, where is this person with readiness to change? If they're a contemplator, we're not going to push them into action, certainly because they're not quite ready for that. So we need to use different techniques in order to move them forward. Shared decision-making. Really? All of healthcare providers should be using shared decision-making. That is an extremely important piece of the puzzle because that person has to feel ownership over these decisions. And it's really important that they understand the decisions they're making about their health. And this is, again, something that coaching really has the time to do. We can talk about, okay, so what would be the pros and cons of making these decisions? Do you have enough information in order to make this decision? So again, through coaching, we can explore that because with accessibility, we have the time. That's literally what our time is spent doing. And then we can build a bridge. And when coaching is part of an interdisciplinary model, which is the case we're trying to make here, is that we can build a bridge. Because remember, right, these folks might come in and they might tell us things they're not telling their provider for whatever reason. We're able to build that bridge. Or there might be something, again, that didn't come up in a primary care visit, but it came up with us because of the things, because of the way we're asking questions, because of the information we're gathering from the person. Now we can help build that bridge. And not only can we build a bridge between certainly the member and their primary care provider, but when you're working in an interdisciplinary model, it could be any of the other providers, or maybe it's building a bridge to additional resources. So Dan had mentioned, like our care navigation team can help people find community resources, can help people find resources within their employer's ecosphere. And again, by the questions that we're asking, we can also start to build those bridges. So, if we're talking to somebody and we find out, hey, this person's really lonely, or this person has issues with food access, we can then start to build those bridges to the resources that that person needs or could benefit them to help bridge, meet their goals or improve their goals, right? So again, we can be a bridge between other providers and the member or between outside services that they may need. And coaching works hand in hand with care navigation to make sure that that person sitting in front of us is getting what they need to be successful. So again, there was an article in the New York Times, I think it was maybe a year ago, although I'm sure as all of you are feeling in the past 2 years during the pandemic time has a totally different meaning. But this New York Times article was all about health coaching. And the bottom line was, even if physicians had the time, they aren't necessarily trained to motivate their patients. Certainly, we do have physicians who love to learn about motivational interviewing and the use of those techniques, but they're not inherently trained to do that. Coaches are. And again, with that board certification, we are training and practicing evidence-based coaching. So it's just a little bit about how coaching can support a primary health approach.
Awesome. Thanks, Danielle. It gives me a lot more knowledge on what health coaching does and is, because honestly, I think a lot of people think, oh, they're going to give me a diet and exercise plan. That's what my coach does. But honestly, it's much more about helping someone's behavior change and making them actually understand maybe the steps to remove barriers. And that is much more powerful and different, especially in an integrated team like you work in. So thank you. I'd love for you to talk a little bit more about maybe some of the tools and resources that make a difference that you guys use.
Yeah, sure. So we use a whole lot of tools in coaching. Certainly we're using a lot of techniques, motivational interviewing, appreciative inquiry, strengths-based coaching, positive psychology. Again, all of these things are, as Dan said, meant to move the person forward. It isn't just telling them what to do. If that worked, I feel like we'd be in a whole different situation health-wise in the country. We're not, right? That doesn't work. You really have to meet somebody where they're at and know when to give those resources. The member really has to buy in to what they're doing, right? If they don't buy into it and they don't connect with what it is you're asking them to do, it's just not going to last. And so we really use those techniques. But in addition to that, when education is required at Crossover, we developed some excellent self-care domains on the topics that we hear of most often. And we used a variety of ways to consume that content. We have podcasts, we have written education, we have live classes, we have on-demand classes, we have fitness classes, and we have videos. So we have a lot of ways that somebody can consume information. And we're really approaching it from, again, building that trusting relationship, because all of the content that we created was created by Crossover providers. So when we're utilizing our Be Well content with somebody, they're seeing the people sometimes that they absolutely know. There might be a provider they've actually met with that is walking them through content that's helpful. And we really started with things we hear about most often, like musculoskeletal pain, sleep, ADHD. We hear a lot about actually food access. Again, that might be a surprise, but especially during the past 2 years with the pandemic and with screening for social determinants of health, we realized how prevalent food access issues really was. And the other one that was a surprise, but also not a surprise, was loneliness. And so we have again, a lot of content around loneliness. So how do you make friends as an adult? How do you start to reach out and start to make connections? Where are you experiencing loneliness in your life? So again, through screening for these things, we started to see what our members were really facing. And then we created content around that. And the content is really action driven, right? So we're giving them enough information to start acting on. And again, we can do that through a bunch of modalities, because we really wanted people to be able to consume information in the ways they feel comfortable. And when you're meeting somebody where they're at, an important thing to know is that not everybody consumes information in the same way. So we wanted to make sure we have multiple ways for people to access and consume that information. And so again, we're addressing mental, physical, social aspects, and it is integrated. The content that we created was created in an integrated way. So it's research, it's original content from the actual care teams. These are our providers, our faces, our words to help instill trust in our model and in our providers. That is a really, really important piece.
Awesome. Really exciting stuff, and awesome to see providers as the subject matter experts inside and outside of the treatment room. It's exciting. It's where they should be positioned to make the biggest impact.
And I think actually, Dan, just to say just a teeny bit more on that, you bring up a really good point. You know, when we're using this, we are absolutely utilizing it again at the right time in coaching. So when education is necessary, or when people need good information to work off of, Be Well is certainly helpful with that. But also when somebody maybe doesn't necessarily need to interact with somebody synchronously, this information can be used to either before maybe working with somebody, they might get enough information from this, especially somebody who's maybe more highly activated, or they're in the action stage. They can take this and maybe run with it, or it might be used even after a coaching relationship or a mental health or a provider member relationship is completed. This also can then help them carry on with those healthy behaviors. So just wanted to mention that as well.
Thank you. No, of course I agree. So let's talk about the impact now. What are some of the impacts of health coaching?
Right. So if we look at the research on health coaching, we can see coaching benefiting people in a variety of ways. And it really boils down to a couple key areas, right? We can see people improve their self-efficacy. We can see people improve their behaviors, and ultimately we can see people improve their biometrics. Coaching's very broad, and it's also tailored to the person who is sitting in front of you. So it's really about what's important to that person. So when we look at the literature on coaching, these are some of the things that we see. People improve their biometrics, they improve their fitness and activity levels, they lower stress, anxiety, and burnout, they can increase their engagement in healthy habits. And, you know, collecting outcomes on coaching can be a little squirrely because people are working on sometimes vastly different things. Like in crossover, right? You might have somebody coming in and they want to work on quitting smoking. And then this other person is working on their fitness level. And then they're all at different stages of change as well. So you really have to sort of a multi-layered approach in how you look at success in coaching. And so some of the things that we've measured along the way, one in particular is something called patient activation. So this is also known as PAM. And when we were measuring patient activation measurement, And Pam has it's a validated tool, and it has a estimated ROI attached to it that has been validated. And we saw an almost $2,000 in projected ROI per person attributed to coaching, attributed to their improvement in activation as they were going through health coaching. And again, we're addressing a broad spectrum of things: health condition support, lifestyle change, self-care support, mindful living. We are looking at a very broad set of things that we can help people with. But at the base of that, at the foundation, is, are we improving something like activation, or if you go to the next slide, Dan, something like health confidence, which is something we're currently measuring, goodness of fit, or what we call therapeutic alliance. These are things that are, again, foundational. And so what does it mean? Well, if we're looking at something like activation or health confidence, we are looking at, are we improving that person's perception of their ability to take care of themselves? Because with that, right, in comes self-efficacy, comes adherence with treatment plans. Because if they're confident in their knowledge, their ability, the fact that they can get care when they need it, that they are a partner in decision-making, that makes all the difference for them engaging in healthy behaviors, in engaging in their treatment plans from other providers, in knowing sort of where to go if something happens. Like, rather than going to the ER or urgent care, I know, as I'm confident, I can reach out to my primary care provider and get help. So we look at things like activation or confidence, and we look at things like therapeutic alliance. We call it goodness of fit. Does this person have an alliance with their coach? Meaning, do they feel heard? Are they working on the things that are important to them, right? Is this relationship working? Is it trusted? And then, of course, we look at member satisfaction. We look at NPS, and our coaches are above 85% all the time. So, and we have great patient satisfaction and NPS. And if you know anything about NPS, and over 85 is a pretty good score. So again, we're looking at these types of things. And then just to share with you a really, I think, great case example of coaching. This person is one of our, this is an actual member. These are their words from one of our California sites. And they said, coaching built healthy dieting and workout habits into my routine, which enabled me to maintain a healthy body independently and sustainably without relying on any tools. My dietary preferences also pivoted towards unprocessed whole foods instead of high fat, high sugar, refined products. And I believe these 2 years of health coaching provided long-term health benefits to me and transformed how I will live the rest of my life. And if we're looking at the numbers of this person, they went from a weight of 206 with a 23.6 body fat down to 19.3% body fat and a weight of 184. And then they sort of landed at a body fat percent about 20% and a weight of 188, which they could maintain comfortably. So the reason I show you this, and also this person, their goals initially was to lose weight, and then it sort of shifted into, I want to become stronger. And so the coach was able to help guide them through that whole process. But a couple things to point out about this is a trusting relationship, and it is long lasting, right? That these people, this member was working with their coach for 2 years. And again, change takes time. And when we have that accessibility to coaching and that trusted relationship, real change can happen. It doesn't necessarily happen overnight, but it happens by having the accessibility, the trusting relationship, the right information to work off of.
Awesome. Well, thank you, Danielle. One more question I have here, and that's around engagement. That's, the problem to solve. There's a lot of great types of services out there right now, a lot of health coaching services that might not get a lot of engagement. What is your secret? What do you recommend?
Yeah, well, so embedding coaching into the integrated team is really helpful because, again, you have those cross referrals happening. You have primary care understanding what a coach does and making those referrals in. And that really takes the load off the primary care provider because they know, hey, I can do these things that are within my wheelhouse as a primary care provider. And I know coaching's got my back with the behavior change, right? So embedding coaching into the primary health model, it really does make a difference because you, again, are getting all of those cross referrals. And of course, primary care refers into coaching a lot, but so does mental health and so does physical therapy. You have somebody in physical therapy or PT who's not doing their exercises and they're not really making progress. Sometimes a visit to the coach to sort of break down, okay, talk to me about the barriers. What's happening here?
Yeah.
Can make a huge difference.
I'd also just add, whether the health coach is doing their work in person or asynchronously or virtually, you're connected to that same care team. You're connected to the same health coach. And, it creates a lot of freedom when you can nudge people through a chat or, jump on a phone call and it doesn't have to be a visit. So this can scale differently and people can access their coach in a different way.
It's very true. And also when you have a coach as part of the interdisciplinary team, it also doesn't even entirely have to be a separate thing. Like you could have a coach drop into a primary care visit or a physical and do some coaching around that. What did you learn today in your physical? What are some of your takeaways? What were things that jumped out for you? What are some things that you might want to start working on, right? So coaching doesn't necessarily even have to be a whole separate thing. It literally could happen with another care team member, but having it integrated into the team is an important piece because, again, somebody's health isn't siloed. It really is integrated, right? Biopsychosocial, a lot that goes into what affects somebody's health. And it really does require a team approach, and having coaching as part of that team really does help people engage with the coach and engage in those health behaviors. One of the other learnings is that there's got to be trust. There really has to be trust. And we learned this. I've learned this since actually in my coaching, 15 years of doing coaching especially in corporate wellness. And I've done many different types. I've done telephonic and I've done the on-site, I've done the virtual, I've done a lot of different types. And what I've found is that that person really does have to trust the person they're talking to. And so sometimes with telephonic, it might be, again, making sure that that coach has the same panel of people that they're talking to over and over again, that coach is trained in ways of building rapport, getting that person comfortable. And then when it might be like an on-site deal or even virtual, letting members see that person's face in different ways. So what do I mean by that? I mean, things like lunch and learns, on-site health education sessions, features in company newsletters, like showing the face of the person that a member could potentially engage in is really helpful because they get to know you. And I can give a really good example. At an on-site clinic, when we first opened up, this was a large company. They'd been around for a very long time, and they had seen the benefits sort of ebb and flow based on the economy. And so when we opened up this health center and we have this interdisciplinary team, nobody wanted to come in. They didn't want to come in. In fact, we would do cafeteria events and no one would make eye contact with us because they were just super suspect, especially an on-site health clinic, right? And I think anytime an employer is engaging in health benefits for their employees, sometimes there's a little bit of that suspicion of like, you're going to tell my employer all of my health information. And so again, it's about trust building. So we just kept at it. We kept showing up. The company we were working with was awesome, is awesome, and they would help us. Like we'd be in the newsletters and we would do cafeteria events and we would do virtual lunch and learns, and we just kept at it. We would be in the places where the employees were. And then we'd have our early adopters come in, be like, all right, well, okay, I guess I'll try it. And those folks then through word of mouth started to spread information about this awesome team. No, they're not sharing your health information. No, they're here to help. I had great service over there. It was super convenient, right? So we started to get word of mouth. A year and a half, I had somebody sitting with me and they're saying, you know, I'm contemplating leaving the company, but I don't want to lose this benefit. So I got to really think about this hard because I don't want to lose this benefit. So I'm telling you that tale because it, you know, especially in corporate wellness, trust is important. And so, you know, seeing the people that they might work with can be helpful and hearing what they have to say, right? It can be really helpful in building that rapport ahead of time. And these are just some of the ways that we've used to make inroads with employees.
Awesome. Well, with that, thank you.
Mhm.
Everybody is much more well-versed in health coaching and all that it is and can be. But let's answer some specific questions.
Sure.
So we make sure we cover everything. I'm going to stop sharing. I'm going to go and look at our question bank here. All right. Are you ready to be on the hot seat, Danielle?
I'm so ready.
Okay, here we go. Question one. How do I assess if my health coaching is really helping my employees?
Yeah, you know, I think in this case, it's important to think about a couple things. We all want to jump to, are we saving healthcare money and what are the clinical outcomes? And those I'm not saying are not important. They're absolutely important, but you have to remember how hard change is for people. Think about your own life, folks. Is it hard for you to change things? Yes, right. And we're living lives that make it exponentially harder to change things about our health. So you have to think a little bit about the long game and then think about the foundational changes. Again, self-efficacy. So, you know, is your coaching program measuring things like health confidence or patient activation or readiness to change? Are we seeing improvements in self-efficacy? Because that is the foundation that those other things are going to be built off of. Is there a trusting relationship there? So things like patient satisfaction, NPS, certainly engagement, maybe things like therapeutic alliance or goodness of fit. Is that trusting relationship there? So absolutely looking at those. Are people making healthy behavior changes? Are they moving more? Are they eating better? Are they sleeping more? So these are things that you want to look at to see, is this helping? Again, we all want to jump right to, you know, do they lose all the weight? Do they change their blood pressure? And again, those things are important, but we also want to make sure we're not missing out on those foundational pieces. Those are also the things that are going to lead to sustained change. Because in my experience, losing weight is easy. Maintaining that loss, very hard, sometimes nearly impossible. So we want to make sure that we're laying the right foundation for people to make sustainable changes.
Great answer. And that leads me into my next question. It gets juicier. Are you ready?
So ready.
Okay, here we go. Do you see a better coaching member outcome when the coach has lived experience? For example, if a health coach has lost a large amount of weight, shares that story with the member and coaches through their weight loss journey, do you look for lived experience through an interview process with your health coaches?
I love this question so much. So, do I think that somebody has to go through everything that our members have gone through in order to help them? No. But do we want to make sure that the experience of our coaches matches what our members need? Yes. And so, what am I looking for when I'm hiring coaches? I am looking for their ability to meet that person where they're at, to have empathy and unconditional positive regard. And sometimes, to this question, that does come from lived experience. It doesn't always, it doesn't have to always. You can have empathy and unconditional positive regard for somebody, and compassion, and that might even be more important than empathy. It's compassion. You can have all of those things without having to have taken, all of the steps that your member has taken. But certainly lived experience can contribute to that. What are we also looking for? People in the community that these employees are living in. We're looking for cultural diversity and cultural competence, right? Because that's going to be really important to establish that trust. So this is such a wonderful question. And again, yes, we do take that into account. That is part of it, is how are people, how are the hired coaches, do they have that skill set? Do they have that compassion to be able to help somebody? And for those of you on the call, the reason I'm mentioning compassion so often, and we often hear of empathy is putting yourself in the shoes of somebody else. Compassion is putting yourself in the shoes of somebody else, but understanding that you are not in the shoes of somebody else, and therefore you are in the place to be able to help them. And so that is the difference. And what we are looking for are compassionate coaches. And yeah, Abby, sometimes that comes from lived experience. It doesn't always have to, but sometimes it does. And it's really that compassion that we're looking for.
Thank you. I knew you'd have a good answer for that.
It's such a good question. A great question.
Yeah. Okay, I've got one more for you.
Sure.
How do I begin the integration process if I already have a standalone health coaching offering as part of my benefits ecosphere?
Oh, also such a good question, because I've worked in places where we had like 11 vendors and they didn't integrate very well. You kind of have to get them all together. So, and we have worked with employers before. We have a crossover that literally got reps from every one of their benefits to work together. And so to get into a room and talk about how can we work better together? What do you all do? What do you do? What do you do? What do you do? Right? That is important. It's important that each of the benefits partners knows what the other one does, and to start forming good working relationships. And at Crossover, we do that all the time. When we're working with an employer, okay, who's in your benefits ecosphere? Okay, cool. Can we can we meet these folks? Can we schedule some meetings? Can we talk about can we get at the very least, can we get the information of your benefits partners so that our care navigators know who to route them towards? Can you give us some information about what that benefit partner does, how they help, so that we can work that into our workflow? A very simple example, fertility. If we have somebody coming in, not necessarily for coaching, although sometimes that's brought up, maybe they're coming into primary care and they're saying like, doc, hey, I have fertility issues. I really, it's something I want to get pregnant or whatever. What do you have for me? And we've trained our providers, the progeny is in your benefits ecosphere. Great. Well, did you know that your company has this benefit for you? Oh, you didn't? Okay. Well, here's what we're going to do. We're going to get care navigation to reach out to you, and they're going to help make this connection to this benefits partner. So it's hard work to get like everybody on the same page, but it absolutely can be done. And I don't know, when you are looking for benefits partners, that might be a question you want to ask them. In what other situations have you integrated with other benefits partners? How? Talk to us about how you're integrating with other benefits partners. Because again, right, all of these things are here for that member to succeed, but it's not going to be very successful if they don't know about it. And you want to make sure that all the other benefits partners know about one another so that they can cross refer, so that they can really help that member get routed to the things that are going to be most helpful for them. So it's not an easy answer by any stretch, but it's sort of the right answer.
I think it's the right answer. Everybody has to work together to get this done. So hopefully we can be, helpful in navigating people to the right place. So thank you everyone so much for joining us today. It was wonderful to talk about health coaching. We will send a copy of this recording to everyone. If you'd like to connect with us to learn more, this is our address. Also follow us on social, of course, at Crossover Health.
And if you're interested in hearing how our providers approach different topics, we do have Crossover's Be Well podcast. Take a listen. You can listen to different providers, our actual providers, and how they approach different topics. So I would put a plug in for that.
I mean, the hosts are great.
The hosts are amazing. They're, top-notch hosts.
Thank you, everyone.
Thank you.